Hi, my name is Abigail Driskell, and today I'll be talking about the population health surrounding the community I chose, which is low-income African American adolescents in the southeastern United States. So, what defines and describes the community I chose? The reason I chose low-income African American adolescents in the southeastern United States are because of current health issues they face and how that can affect childhood development. I specifically chose the southeastern United States because it's notoriously known for having low income. A study done in 2019 by the American Community Survey shows that 33% of African American children in the South live in poverty. The factors that contribute to these statistics include socioeconomic factors such as access to education and income, and certain social determinants of health that will be discussed next. The determinants of health I found for low-income African American adolescents include mental, physical, and social well-being, which are all important, but especially important to a growing and developing child. For this project, I focus mainly on the mental health aspect. Regarding physical health, lack of affordability and accessibility due to low income can stress this heavily. Not getting routine checkups at clinics due to price or distance, lack of healthy food, such as communities and food deserts, and lack of proper support can all affect this. When looking at social well-being and the effects it has on this particular population, there are a lot of stressors African American adolescents in low-income areas face. Public safety is a major one. A study done by Professor Zulika Henderson that interviewed low-income African American teens and the trauma they face showed that the top three traumatic stressors they experience are experiencing and anticipating death and loss, experiencing violence, and dealing with police harassment, racism, and discrimination. Low-income African American adolescents are not only carrying trauma and stress from dealing with monetary issues, but also stress from being in fear of losing their or a loved one's life. A quote from this study states, "Participants also described that Black teens from their neighborhoods commonly lose parents, siblings, and friends to violence and incarceration, or lose other family members to health challenges, including cancer." This also relates back to the physical health aspect, as health problems in adolescence may be overlooked or ignored due to bigger issues in a family's life, such as personal or familial traumas. Mental health issues influence health statuses in the adolescent African American community pretty drastically. The stigma and taboo surrounding mental health issues are already a pretty prevalent thing in society for everyone, but it's a greater challenge surrounding African American families, especially low income. Cost and accessibility are factors that can deter anyone, especially a child or teen seeking help. If an adolescent from a low family income is suffering and struggling mentally, they may push it down and see it as a lesser problem than real problems, such as monetary or tangible issues. Mental health issues are also prevalent in African American single parent households, as many are maternal or consist of a female guardian. Studies have shown that the lack of a paternal figure in the household have effects on the psychology of female adolescents with respect to the emotional aspect. A study conducted by Dr. William James in 2015 showed that the association between father involvement and educational outcomes had positive correlation for African American adolescents. The social determinants of health that influence these health factors include historical, social, and economic contexts that create health inequities. These factors can all be related back to lingering structural racism and systemic bias rooted in both social and the healthcare systems. The Office of Disease Prevention and Health Promotion put it best. Residents of impoverished communities often have reduced ability to resources that are needed to support a healthy quality of life, such as stable housing, healthy foods, and safe neighborhoods. Poverty can also limit access to educational and employment opportunities, which further contributes to income inequalities and perpetuates cyclical effects of poverty. Taking a glance at the epidemiological approach, the main health issues I want to focus on are mental health issues and how they correlate and affect different aspects of health. Stress caused by traumas are a health problem that plague this community. Social determinants of health that influence stress levels within this population include higher exposure to violence, lack of community and safety, and cultural stigmas surrounding the perception of receiving help. According to a study conducted on low-income African American adolescent girls, it has been found that those who experience at least one form of victimization or trauma tend to experience co-occurring adversities. These traumas and experiences have unfortunately shown to have correlation to the probability of teen pregnancy. In an article written in 2021, authors Barbie et al. Talked about a study done on African American adolescents. They say, several studies have reported that low-income and traumatized youth have a greater probability of teen pregnancy, as well as early marriage and parenthood than other youth. All of these stressors can drive adolescents to unhealthy mindsets and coping mechanisms, which can lead to issues in adulthood. The health issues I'll be focusing on in depth are mental health issues. Stress, trauma, and victimization all affect the mindset and mental health of low-income African American adolescents. Stress can be caused by a number of uncontrollable socioeconomic factors, including low-income households, single-parent households, lack of public safety, lack of education, etc. A study looked at the intersecting experiences of perceived racial discrimination and poverty-related stress in pre-adolescence, and results found that these experiences were associated with greater psychological problems. When observing low-income African American adolescents who experience mental health issues, authors Gershon et al. Reported that studies show that young African American women who experience high levels of victimization and trauma were more likely to show signs of depression, and if the trauma is prolonged, it can lead to sustained and repeated victimization. Findings from these studies can also indicate that there are pathways linking victimization and trauma to depressive symptoms in a socioeconomically disadvantaged sample of African American adolescent girls seeking mental health services. In a study done on how low-income African American teens define the trauma they experience, it's found that the unexpected loss of their peers from incarceration, death, or being victims to gun violence or stabbings are the main reasons. 3 levels of prevention can be applied to mental health issues surrounding low-income African American adolescents. Regarding primary prevention, or reducing risks before they occur, starts early. Exposure to systemic stressors such as poverty, racial discrimination, and violence increase risks of anxiety, depression, and trauma-related disorders. These stressors, combined with lack of resources, can cause risks to one's mental health. Secondary prevention relies on the accessibility of clinics and professionals. Lack of funding in underserved communities grant challenges. Tertiary prevention and management are equally as important. When resources are limited, affordable community-based support is vital for management. Overall, there's a lack of accessible and quality healthcare in low-income communities, which affects all levels of prevention. Community support and outreach programs are essential in benefiting those in low-income and underfunded communities. The structure of the American healthcare system is built against low-income African American women. Studies have been conducted regarding this population of women and the disparities they experience in healthcare, specifically through an intersectionality viewpoint. Intersectionality is defined as the experience of a person who has multiple intersecting statuses, such as income, gender, race, etc. The findings, reported by Dr. Okoro in 2020, state that low-income African American women experience 4 major themes in the healthcare system, which are the perception of not feeling heard, the patient is the expert of her own body, disregard for the patient's preference, and the need for self-advocacy. These stem from provider implicit bias, stereotypical assumptions, and systemic structures that enable discrimination in the healthcare world. The change to a value-based system would benefit low-income African Americans drastically. It ideally would eliminate structures that enable discrimination and also reduce costs. It could also reduce stigmas surrounding seeking help if help is more readily available. When looking at the future trends of African American health, it's important to understand that the system has been set up against them. African Americans are currently the least healthy ethnic group in the USA. Racial and social injustices that have been lingering for years propose a formidable challenge to equitable healthcare. Systemic reasons behind poor healthcare for African Americans need equally systemic changes and solutions. Positive trends in health have been driven by multiple factors, such as social development programs, better investments in education, the participation of African Americans in policy, decision-making based healthcare, and the expansion of access to healthcare in general. Strategies for solution include and require the system it's built on to be broken down and fixed. Value-based healthcare is a step in the right direction. Until then, providing educational and health-related resources in low-income and underserved communities will help prevent, manage, and overcome health issues for adolescents and adults alike.